Hi everyone, welcome back to Vision by Design YouTube channel. I'm Trevor and this is Dr. Sarah Keep. She is a vision therapy optometrist and she's in the Edmonton area, has her own clinic called Vision by Design. It's fantastic. And today we're going to be talking about classroom behaviors and what it means about your visual system. So Dr. Sarah, maybe share some information about that with us today.
So 80% of learning is actually based on visual information. So our eyes play a really critical role in our ability to learn and function in the classroom. So oftentimes when we do a routine eye exam and we catch a patient where they have a binocular vision issue, parents are often really surprised. So a lot of parents really do think that as long as their child sees 20/20 and that they have good vision, that they're not going to have any issues with their schoolwork. But what a lot of people don't realize is that there is actually a number of different visual skills that are required to be able to read properly and learn properly. So it goes beyond just seeing clearly. So a lot of the symptoms or the behaviors of these visual issues, they're often not attributed to a visual concern, especially if the child has already been told that they have really good vision or don't require glasses. So I'd like to spend some time in this video talking about what good vision actually means and what behaviors to look for, as well as what sort of deficiencies and stuff like that are, or what sort of visual skills are important for learning and reading, and exactly how these behaviors, which seemingly are not visual behaviors, are actually maybe connected to your child's visual performance.
This is going to be great. We're going to learn a lot of great things here today, so stay tuned. What is vision? And what visual skills are required for good classroom learning?
Yeah, that's a good question. So if you ask somebody what good vision means, they'll often say it means seeing clearly or having 20/20 vision or not requiring glasses. So people always equate good vision to seeing clearly. But what we don't think about is all of the other things our visual system does as well, and how we use these other skills, in a classroom for learning. So there's actually a number of different visual skills that are critical for learning, and specifically reading. So if you think about reading, for instance, not only do you have to see the word clearly, but you have to be able to keep your eyes pointed on that target and keep both eyes lined up together so that you don't see double. And then as you move your eyes from one word to the next, they have to be able to jump from one word to the next so that you don't lose your place. And while you're doing this, your eyes have to stay focused so that the words are actually clear. So this is really complicated to actually keep all of these skills and utilize them together to be able to read clearly.
Now, the next question that a lot of parents might have is how many children are actually affected by problems with their visual system?
Yeah, that's a good question. So actually 1 in 4 children actually have problems that are significant enough to cause reduced performance in school. Oftentimes, these children actually see very well and they don't complain of symptoms. So it's reasonable to assume as a parent, if your child has good 20/20 vision, naturally you would assume that they have good enough vision to perform well in school. So, I always have patients, when they come in and, we ask how their child is doing, they'll say, oh, their eyes are great. They can see that little airplane off in the sky. Like they definitely don't have any problems with their eyes. And they often don't complain of symptoms like blurry vision, for instance. But it's important to note that just because a child doesn't complain of symptoms, it doesn't necessarily mean that they aren't experiencing them. A child doesn't know what normal vision is. So I've had children before where they actually see double and they don't know that that's not normal. So when you ask them, do you see double? They don't know what that means. So, then they're going to say no unless you actually, show it to them. So they might not be able to articulate the eye strain that they're experiencing, for instance. So instead it shows as behaviors like frustration or avoidance. So for these kids, this is just their normal. They don't know that it's not normal to be experiencing things this way. So I always like to look for certain behaviors rather than symptoms, especially in young kids where they don't know what normal vision is.
Right. Now, what are some of the common behaviors that we should be looking for?
For sure. So one of the biggest red flags is avoidance of near work or lack of attention when they're doing specifically visual tasks. So a lot of the kids that we see in the clinic, you know, they've been told they have an attention issue or have been diagnosed with ADHD. And the key is, if these symptoms are occurring only when they're doing visual tasks, that tells you that it could maybe be a visual symptom instead of truly ADHD. So I mean, if you have your child and they, you know, they pay really good attention doing other tasks that aren't as visual in nature as reading, then that could be something where we want to explore things a little bit more. Another one is, you know, just frustration with schoolwork. It often causes discomfort. You know, if you can imagine if things were going in and out of focus or, you know, becoming double, that's really hard to look at. So it causes frustration. Kids don't want to do a task that is making them uncomfortable. So, you know, that's the constant battle doing homework, for instance. Another one is just taking a really long time to do assignments. So some children, they still have pretty good school performance, but it's because they really slow things down so that they're not making mistakes. So if it's really hard for you to look at something, if you do it a lot slower, it's easier to kind of take that information in. So these children might still perform well in school, but it takes them a really long time. They're not doing it very efficiently.
Dr. Sarah, can you maybe go into a little bit more detail about some visual issues and how that might look to a child?
For sure. So I'll talk about some of the more common binocular vision issues and kind of things that parents can look for.
Sure.
And, you know, maybe even show you what your child might be experiencing if they have these. So convergence insufficiency is one of the most common binocular vision issues. And whenever I say that in the exam room, I get this blank look on my face. What does that mean? So convergence simply is the eye movement instead of looking straight. So when we look straight, our eyes should be straight when we're looking far away. And then when we go to look up close, they need to turn in so that they're both pointed at the same target. So that inward movement is called a convergence eye movement. And then insufficiency just means not enough of. So convergence insufficiency means we can't turn our eyes in enough. It's not efficient to be able to do that. So what happens to a child if they have this is sometimes they really struggle and they pull those eyes together and then they see a single target. And then as they start to get tired, their eyes drift out ever so slightly. And it's a really subtle movement. It's not anything that we're going to be able to notice if we're looking at them. It doesn't cause an eye turn or anything like that. So, but that subtle misalignment actually causes the words to double. So this is actually what it can look like for a child who has convergence insufficiency. And you can see that's extremely uncomfortable to look at. So children who have this will often, you know, have eye strain. They don't always mention that they have eye strain because, again, they don't know that that's not normal. So rather than, you know, saying, hey, mom, you know, my eyes hurt, more likely they're actually just going to get frustrated or avoid doing the task. And then, you know, the teacher's going to force them to do it, or, you know, the parents are going to force them to do their homework, and it's causing discomfort, you know, so it does really cause a lot of frustration in a lot of these kids. Other kids will just flat out not do it. So if they're sitting in a classroom and they're told to do a task up close and they're really kind of moving in and out of focus, they're just going to get up and do another task. So this often looks like they have an attentional issue because it's hard, you know, to sit there and do a task that looks like that. Another really common issue that we see with kids is a focusing issue or an accommodative issue. So we have to be able to use our eyes to focus up close. So there's muscles in our eyes. When we look far away, those muscles relax to make our vision clear for far. When we look up close, those muscles have to focus to make them clear for up close. And for some kids, that's really a really hard movement. And it actually causes, you know, physical discomfort again. So, you know, if I am just lightly focusing my hands and that's something easy for me, it doesn't hurt my hands to do this. Whereas, you know, if I really struggle to, you know, hold my hands like this and I really have to squeeze to get them to focus, that actually starts to become really quite uncomfortable. So, I mean, even if you do this right now, if you try to, you know, squeeze your fist like this for a couple of minutes, it's going to physically start to hurt after a while. You're probably not going to want to do that for 10 or 15 minutes. Whereas a child in the classroom, they are asked, you know, to do reading tasks for, you know, 10 or 15 or 20 minutes, and they start to become really uncomfortable. So it causes headaches. But again, they might not be complaining of these headaches. They might just actually give up. So, you know, if you seem like, if your child seems like they're not motivated to complete their task, it might be that it's actually causing them discomfort. They often have reduced endurance, or, you know, they fatigue really easily. So, you know, if you have them do, certain assignments or certain reading tasks, and they do great in the beginning and then they just kind of tucker out. That can often be a sign of a visual issue. Or again, they may have reduced reading comprehension. You can imagine that if you're reading text and it's going in and out of focus, kind of similar to this, again, that's really hard to look at. So, you have to kind of pause and, let things clear up again. And not only does that affect your reading comprehension because it kind of breaks the task up, but it also really affects your reading speed as well. Another really common issue that we see in children is an eye tracking issue. So you have to move your eyes, as I mentioned, if you're reading a paragraph from one word to the next to the next. And if you can't do this accurately, you're going to read words out of order. So this can be what it looks like for a child who has an eye tracking issue. And you can see, rather than them moving their eyes nicely from one word to the next, they're really skipping around. They end up reading the words out of order. And then when they get to the end of the row and they have to jump to the next row, that's a really accurate eye movement that they have to do. And if they can't do that, they end up, reading the wrong lines and stuff like that. So you can imagine what that does to their reading comprehension, if they're not reading a paragraph in order. So these children will often, again, they'll avoid they'll avoid reading. They won't enjoy reading, or they'll enjoy it if their parents read to them. So that's usually, a really good sign for me that if your child loves having you read to them, but they hate reading to themselves, that's really a red flag that there's a vision issue going on there. Some kids as well, they might enjoy reading. A lot of kids still do enjoy reading, but they just really slow down their reading speed. So rather than, struggling with things, reading words out of order, they'll just read at a really slow rate. And then they can follow along a little bit more accurately. Or they'll actually use their finger to follow along. So they may not necessarily be making these mistakes if they've learned certain adaptations to try to live through them. But that also affects their school performance, especially as they get into the older grades.
Right.
Yeah.
Well, that is some great information about the different symptoms and what your child might actually see when they have a vision issue.
For sure.
That you don't really know that they're actually seeing it, and they might not be able to explain it to you. Now, Dr. Sarah, are these all of the different behaviors, or are there more?
There's lots of behaviors to look for. So it really depends on what their diagnosis is. Your visual system is involved in, so much to do with learning. So the ones that I've talked about previously are, the way our eyes gather visual information. So it's how we line our eyes up and how we focus our eyes to actually get that information back to the brain. But another component of our visual system is understanding that visual information. Right. So children can also have difficulty with their brain processing this visual information. So this can result in other symptoms. We can see kids where they have reversals, for instance, where they have difficulty with B's and D's because they really don't understand that there is actually a difference between a B and a D. So, they look the same. It's confusing. When we're learning, about objects when we're young, and you look at a coffee mug, it's a mug whether it's, facing this way or this way. It's always a mug, whereas, all of a sudden they get to school and there's a letter that's flipped around and it's a B this way, but it's a D this way. That's hard for them to understand for some kids. Some children will also have difficulty with things like sports performance. If they're clumsy and have difficulty catching a ball, that can be a sign. We can also see children where they have difficulty spelling. This is a big one as well. When I talk to parents and they have, the types of visual issues that would cause spelling issues, and you ask how their spelling is, and they're like, oh, it's great. They always ace their spelling tests. But then when you push a little bit further and say, well, what about when they're writing a paragraph? Do they spell them properly in a paragraph? And they don't. And the reason for that is they've just memorized, using auditory cues of, in their mind, they'll say car, C-A-R, C-A-R, C-A-R. And they can do that, for a spelling test, but when they actually are going and writing it in a paragraph, they're not using that technique anymore, and then they can't remember how to spell words. So there's lots of different school performance issues that can be linked to visual issues beyond just what we've talked about today. So the best thing to do would be actually, if you have concerns with your child's school performance, is have them assessed to see what you're kind of dealing with, and see if that's something that it could actually be the root cause of some difficulties they're having in school.
Great. The next question is, why are some of these vision issues missed?
Yeah, that's a great question. So This isn't always tested during a routine eye exam. So even in our clinic, we don't necessarily go through and do all of the tests that are required for these vision skills. Our office screens for these. So, I mean, if you come into our office, every child, we ask them different questions when we take their history. So, we always ask about school performance and stuff like this. And the funny thing is I actually find a lot of parents, they don't see these as a history question where we're trying to gather information. They see this as a social question. So, you come in and it's like, hey, how's your day going? My day's great. The same thing happens when we ask about school performance. So, I always say, hey, how's, little Susie doing in school? And their parents are like, oh, she's doing great. And then as you go through and do their exam and, you start to see some of these deficiencies, and then you ask, is she really doing great in school? And they're like, well, no, she's not.
One of those auto responses like, how you doing? Oh, I'm fine.
Exactly. And a lot of it as well is because they don't have vision on their radar. Last year their eye exam was perfect and they saw 20/20. So they're expecting to have a perfect eye exam. So they don't understand, why would I say, that Susie has difficulty spelling? That's not information that, has anything to do with her visual system. So, if these issues aren't brought up, they may not be tested for. We obviously in our office, because we treat this, we do go through and do additional screening that would not typically be included in a routine eye exam. So during a regular eye exam, we really are focused on what glasses prescription do you need? And, are your eyes healthy? We do a really thorough check of the back of the eyes and stuff like that. It may not include the testing required to see if there are eye alignment issues or eye focusing issues or, visual perceptual issues and stuff like that. So, it's a really great idea when you get your eyes tested is if you have any concerns, make sure that you bring them up, even if you may not necessarily think that there could be some vision concerns.
Okay, now if someone sees these behaviors in their child, what is the next step? What should they do about it?
I would recommend doing an eye exam, or our office also offers a complimentary consultation with our vision therapist. So, if you're not sure that what your child is experiencing could be visual in nature, it's a great way to actually, sit down with somebody where they can tell you, what could these behaviors that you're experiencing or these troubles your child is having in school, what could they be potentially? Because it's challenging. We have patients all the time. Sometimes we see people where we treat them in high school or university and they've struggled with these issues for years. And, it's something that can be corrected, relatively easy in a relatively short period of time rather than having to struggle through them. So, if you feel like your child is struggling in school, they may need something more than just a routine eye exam to see if there could be some underlying visual issues.
Yeah, and it never hurts to find out. Never hurts to ask the question because, the way that I see it, I've worked with you for a little while and you guys are really trailblazers, I think, when it comes to optometry, and you're going to help the whole visual system and not just check for 20/20 vision, give you contact lenses and so forth, but you're looking to really find solutions that, previously didn't really exist. And, today, if you're having some issues and you see some of these behaviors in your child, just call Dr. Sarah Keep, call Vision by Design, and get an assessment. They're there to help you. Give them a call or visit the website visionbydesignoptometry.com. And thank you so much for joining us. We'll catch you on the next one.